topics and opinions expressed in the following show are solely those of the host and their guests and not those of W4CY Radio, its employees, or affiliates. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. No liability, explicit or implied, shall be extended to W4CY Radio or its employees or affiliates. Any questions or comments should be directed to those show hosts. Thank you for choosing W4CY Radio.
Welcome to the Ask the Expert show on W4CY Radio and Talk4 TV, where we bring you educational information from top local experts in the fields of legal, health, financial, and home improvement. Now sit back and listen to experts in family law, association law, hearing loss, business brokers, home care, along with many other topics. Now here are your hosts, Steve-O and Sophia.
Hey, good afternoon, Houston. Welcome to another Ask the Expert show where we bring you the top experts in the field of legal, health, financial, and home improvement. You have been asking for several years for us to add a show on sleep disorders. We've actually not had an opening up until now, but we found one of the top experts, not only in sleep disorders, but also in ear, nose, and throat in Sugar Land, Texas. That's right outside Houston, as you know. Let me welcome our new expert, Dr. James Ludwig.
Hello.
Hi, James.
How are you?
Good. So this is your first show. Tell people about your practice.
Well, I'm a solo practitioner. I trained at, I went to medical school in Ohio, and I trained master residency at Baylor in the medical center. That was in 1999. And then I trained at Baylor. I finished my ENT residency in 2004, and then I did a fellowship in sleep medicine with the pulmonologist so that I could become boarded in not only ENT, but also sleep medicine. So I have a board certification in head and neck surgery, and then I have a board certification in sleep medicine, which is very unique because I'm pretty much the only ENT that did a fellowship in sleep, at least in the Southern United States. So I'm proud of that. And then I worked at Ben Taub and Methodist and Texas Children's. For a few years, I did teaching as a faculty member, and then I ended up opening my own practice. And I'm a solo practitioner, and I treat a lot of patients suffering from sleep apnea. I see at least 1,000 new sleep patients a year, just myself. And then I do a lot of nasal sinus care because that's very closely associated in a lot of people with their sleep apnea problem, either treatment or cause or whatever.
James, since you're talking to someone who totally understands sleep apnea, who's on not a CPAP, I'm on a BiPAP machine. It is so important. This is one of the things we want to get across to people, that you cannot let this go. And when your partner tells you stop snoring and you say you're not snoring, because it is a little embarrassing, that it's time to go in and have it checked out. Now, James, gosh, I didn't realize that now. It used to be when you would go in for a sleep test like I did, you would have to go to a clinic. Now I understand they're doing it at home.
Yeah, that's nice. So we do home sleep testing. Most people with just straightforward obstructive sleep apnea. There are various home sleep tests manufacturers. We use one made by Philips, but you do them at home in your own bed. They're one night. They're actually only it's about $150 test. Very inexpensive. And to your point about snoring, the snoring isn't sleep apnea. Snoring is a noise, that someone makes when they sleep. And what I always tell my patients, what I point out to them is that, snoring is really a sign that you're developing a significant amount of resistance to airflow. Because if you think about it, nobody snores when they're at work or when they're awake.
Yes.
We're not sitting here now, and I've been accused of snoring. So We're not sitting here now snoring on the air. And the reason that is because if you're snoring, you're having a lot of change to your airway. That's what it tells you. It doesn't mean you have sleep apnea, because sleep apnea is when you get so much change to the airway, it gets so much smaller, you can't get enough air. You don't have to wake up dying or gasping to suffer from this condition. You just have to have episodes where you're not getting enough air, and eventually, your body needs to fix that condition, and it does that by having these little arousals, and then those arousals are what make you feel bad, because if you keep doing that over and over and over again, then your sleep becomes fragmented unbeknownst to you, and you basically feel sleep deprived all the time. So snoring doesn't mean you have sleep apnea, but certainly it's something that's telling you your airway isn't that great when you're asleep.
So how does a person know how do they know to even contact you that they might have sleep apnea?
Well, there's different reasons people come in. Some of the more serious things would be like what you were mentioning, that maybe they have a procedure or colonoscopy, some kind of sedation, oral surgery, and the doctor tells the patient that, man, you need to go see a sleep doctor. Some people, it's their, like you said, significant other, you're there gasping at night and not breathing, and the person next to you is, worried about you, like wives or things. So they'll encourage patients to come in. Pretty much anyone that has heart failure or had a stroke. I mean, a very, very high percentage of those patients are suffering from sleep apnea, whether they know it or not. And then patients who just feel bad, like they're just tired. Eventually they just get, this is an insidious condition. It doesn't start, like you don't wake up one day with sleep apnea and you didn't have it the day before. If you did, then you would know right away there's a problem. There's a reason they call it, did you wake up on the wrong side of the bed? When people who don't suffer from sleep disorders and you don't sleep well, it because you normally do sleep well. So you have that normal baseline. But people that suffer from untreated sleep apnea, they don't know, that they're not feeling right. They just attribute, or if they do think they're not feeling right, they'll attribute it to things they do know, like stress, work, I'm not sleeping enough, overweight, yada, yada. You're not going to attribute how you feel to something you don't even know what's happening. So, anyway, those are the reasons people come in, and a lot of people come in and they've had this for a decade or longer, and they don't know it. And so it's very eye-opening for patients when they find out they have it. And, to be honest, I know you said you have a bi-level or a BiPAP machine. And I think a lot of reason people don't come in is because they don't want a CPAP machine. They don't want the treatment. They already know they have it. Like deep down, they know they have it. But if they were to actually come in and get diagnosed, then they would be like thrown in their face. Now they can't just assume they have it. Now they know they have it. And now they're forced with a treatment decision. But the good news is that most people that get a sleep test, well, I'll tell you, everyone gets a sleep study, at least anywhere else but here. Everyone's going to get a CPAP machine. I mean, it doesn't matter if you're the mild guy or you're the super serious, severe guy. They all get the same treatment. But that's not how I treat my patients. So there are actually a lot of treatments. There's, appliance therapy, there's surgeries, there's neurologic neurostimulation implants. Nasal surgery sometimes can be very helpful. So I think that the barrier to diagnosis sometimes is the fear that you're going to be relegated to a CPAP your whole life. And, some people, like apparently yourself, are okay doing that, because if you sleep well with it, you don't really care what it is. It could be a helmet for all you care. You might feeling good. So, it doesn't matter, and you're not snoring, and frankly, it's safe to do. So there's no risk to you using that. But I do think for a lot of people, the barrier to evaluation is the fear of the answer, and then the fear of the CPAP machine. That's my theory.
Okay. God, that makes a lot of sense.
Yeah.
How do you diagnose them or you evaluate them?
So it's kind of cool. We have I have a couple 50-inch monitors in my exam rooms, and we do endoscopy of the nasal airway, throat airway, of course in your mouth. And none of that tells somebody, whether or not you have sleep apnea, but you certainly can see things that would be giving you problems moving air. And then we're going to do the home sleep test. And the nice thing is, in my office, you get it the same day. So you come in the way most people get diagnosed is they go to their family doctor or whoever, and they order a test, and they get a test from somewhere else. And then that somewhere else tells the doctor that you have sleep apnea, and then they ask for another order. And then you go back to the same place, get an in-lab titration, or maybe a DME company gives you a machine. And then, so a stranger gives you the machine, and now you're having maybe problems using it. So you go back to your family doctor who he's never learned how to manage CPAP machines or even use CPAP machines. So he's telling you to ask the company who gave it to you, how to use it. So, and then later on, you'll go see the ENT who's a third or fourth provider. So you're seeing like 3 or 4 people to get diagnosed and treated. But because of my just unique, background, fortunately, we do all at one place. So we have CPAP machines here. I fabricate oral appliances. Well, I don't fabricate them here, but I scan your mouth and do all the impressions and whatnot that are needed. I do all the sleep surgeries except for oral maxillofacial surgery procedures, which nobody really gets anyway. And I work with some sleep dentists if people need like palatal expansion or other things. So the nice thing is that when people come here, they really just see me. And because I've done this for 20 years and I've literally taken care of, thousands and thousands and thousands of sleep patients, you just learn like any other profession. You learn a lot. People teach you a lot. Your patients teach you a lot. And the more you see, the more you know. And you learn how to put these different treatments together, to make someone as successful as they can be in treating their sleep.
Which way have you found to be the most successful way to treat sleep apnea?
Well, it depends what
you have different ways.
Well, it depends on what you define success. If you're defining success as cure, which means you no longer have it, the reality is some people that's not technically feasible. Like say, for example, you didn't want your CPAP machine. You said, I want surgery. It may not be technically feasible to cure you. It may be reasonable to make you a heck of a lot better than perfection, but a heck of a lot better, still a heck of a lot better when you have no treatment at all, So it really depends on why you have airway obstruction. So the way, going back to your question in a circular way, is the way we evaluate if someone really wants to understand why they have sleep apnea, because a sleep test does not tell you why that you have it. It just tells you you have it.
Okay.
It's like your sink doesn't drain and you don't know why it doesn't drain. Okay. You just know it doesn't drain. Drano is CPAP. You pour the Drano in and whatever the problem is, it finds it. And now your sink drains and all you care about is your sink drains. But if you don't want to use Drano, you want a plumber to come out, you don't want him to tear apart your house. You want him to know where the problem is. And so for sleep apnea, that analogous thing is called sleep endoscopy. So what we do is we actually knock you out with drugs like propofol. And then we do an exam with the camera of your airway and we watch you obstruct. And then we understand why you obstruct. So sleep test tells you that you do obstruct. Sleep endoscopy, to the best of our ability, tells you why you obstruct. And then once you understand why you obstruct, then you can start talking about, other treatments, surgical treatments for sleep apnea. But to try a CPAP machine, again, you don't need to do that because a CPAP machine keeps your entire airway open. It doesn't matter where the problem is for 95% of patients. And then for some patients, honestly, oral appliances are better because I don't know if you don't even like this, but I used to date a girl and when she would sleep, like her mouth would just, like her whole mouth would open or her jaw would fall back. Okay. So if you're doing that, then that means everything in your mouth is falling back. And for those patients, honestly, oral appliances are a better treatment because oral appliances keep your mouth closed and they either stabilize your jaw or they help you move it forward. So for that patient, an oral appliance would be the best therapy, at least as part of their therapy. Now, it may not be all they need. And so that's the trick, is to put together something that gives someone a lot of benefit, especially the patients who are unwilling to use CPAP. Because I see a lot of people, a lot, who they're diagnosed 5-10 years ago. They tried CPAP for a week or two, a month, this mask, that mask, and they're not like you. They're not able to use it. And so they just give up, and they literally live the rest of their life sleeping like crap and they just accept it. And I think that's terrible. So for those patients, something is better than nothing. And there are a lot of things that we can do to help people feel a lot better, even if we're not curing them. Some of them are cures, but just to be realistic, making someone feel a lot better is a home run for most people.
We just got our first text from Joe in Galveston. I am really enjoying this show. I suffer from sleep apnea. I am definitely going to make an appointment. My question to you is, what happens if you don't take care of this?
Yeah, that's a good question. So, I used to have a lab. I had a lab for 10 years next to my office. I don't have a lab anymore because insurance doesn't pay much for testing and you can't get them approved. So financially, unfortunately, it was not doable. But for 10 years I did. And what I liked about having my sleep lab, and I promise I'm going to answer your question. I'm going to get there, so be patient with me. But when I had my lab, when you have a real test, you have a whole EEG. So you have like the whole EEG montage. You have a 12-lead EKG all night. You have airflow sensors, 2 of those, oxygen. You have leg movement sensors. You have muscle tone. Eye electrodes. So you're getting a lot more information, which you don't necessarily need to diagnose sleep apnea. But what it was great for was we also had this infrared camera. And I'm going to tell you, all your listeners, you need to do this. If you think you have sleep apnea and you have an iPhone, on your iPhone in the camera setting, there is a time-lapse photography option. Put that camera or that phone on your nightstand, put a nightlight on so you can see, and record yourself sleeping all night. If you're all over the bed, you have sleep apnea very likely. Because remember, every time you obstruct, you have to come out of sleep to fix it, whether you know it or not. And that causes your body to move. And so people literally are very restless when they sleep with untreated sleep apnea. And some people are having 100, 200, 300. I have a guy last week, 500 obstructions in just one sleep period. Imagine 500 times you can't breathe. It's just crazy. And this guy has a job and kids. I'm like, how do you even function? It blows my mind. But anyway, so the reason I bring this up is I had the infrared camera and I had all the tracing. So not just a report. I wouldn't even show my patients the report. What I would do is I would bring them over to a screen and I would show them their tracings. I would show them their EKG because everyone knows an EKG because they see it on ER shows and stuff. They know what EKG looks like. They kind of know heart health. And I would show them the airflow channel, going up and down. And then I would show them their EEG. And then I would squeeze it all together so you could see the breathing. And you could just watch when you obstruct, your heart rate, if your normal heart rate is like 80, it'll go down to like 40 or 50. So while you're not breathing, and these obstructions, by the way, they don't last 5 or 10 seconds. These things are lasting 10, 20, 30, 40 seconds long.
Wow.
Literally. So
where you literally stop breathing.
Yeah, it's like the airflow channel looks like flat line, like you're dead, okay? And then your heart rate plummets. It goes way down. You get bradycardic. It's just a natural physiologic response to the obstruction, okay? And then remember, to fix that obstruction, your brain comes out of sleep. So you can actually see the EEG get really high amplitude. You draw a line straight down, and all of a sudden you'll see the airflow restart. And then the heart rate goes from 40 to 100 to 120, okay? So now imagine you're sleeping all night long. Your heart rate's going from 40 or 50 a minute, beats a minute to 100 beats a minute to 40, 50 beats a minute to 100 beats. And on top of that, remember, when you obstruct, you're not moving air, so you're still alive. So you're burning oxygen, but you're not replacing it. That's why your oxygen goes down. And at the end of your obstruction, when your oxygen's the lowest, you have the arousal, and then your heart rate shoots up. So when your heart rate's 110, your oxygen's 80. By that, I mean 80% of your blood has oxygen and 20% doesn't. And then when you obstruct and your oxygen's 100 now because you were breathing the last few, few breaths, your heart rate is 50, but your oxygen's 100. So it's the exact opposite of what you'd want, right? You don't want to go run and put a bag over your mouth and not breathe, right? You want the most oxygen when your heart rate's the highest if you had a choice. So the long-term consequence, this is the cigarette analogy I use. It's like, yeah, doc, I know I got sleep apnea. And yeah, doc, I know I should stop smoking, right? And no one cares until they have their cancer diagnosis or their COPD diagnosis. And it's the same thing with untreated sleep apnea. It's like, yeah, doc, I know I got to treat my sleep apnea, and then they get a heart attack at 55 or they get a stroke at 55. And now they're like, God, I need to treat my sleep apnea. It's like, yeah, that's what you should have done at 35.
Right.
And sure, we're going to treat it now, but you get my point. It's like, do we have to die first or come close to death before we figure out that we should be doing what we're doing? And unfortunately, a lot of people need like near-death experiences to change. But it does have to be that way because, again, like I'm saying, there are other things you can do to make it better outside of air pressure. And I'm not saying that you shouldn't do air pressure, because as a treatment modality of doing what it's supposed to do, air pressure is the best for most people. But I mean, if you can't use that modality, the answer isn't to do nothing, you know?
James, I got to tell you, I've been doing this show for 14 years. We've had in other markets, we've had dentists to do. We've had some doctors. I got to tell you, this is your first show. I have learned more from you in the 25 minutes that we've been on that makes so much sense. It is so obvious that you are so way ahead of the game.
Thanks. Yeah, it's just, well, like I said, it's just, the problem with sleep apnea is like treating cancer, you know. Do you want to have your head and neck cancer treated, you know, at 5 buildings with 5 doctors who don't know each other? I mean, you know, that's the beauty of going to, say, MD Anderson. I trained there. You know, you know, for those unfortunate people that do have to, you know, suffer through those conditions, and it's not fun, head and neck cancer by any means. But I mean, to treat head and neck cancer, you need a head and neck surgeon, you need an oncologist, you need a radiation oncologist, you need a speech therapist. And what's great about MD Anderson is that they're all next to each other. You just go from one to the next, you know, and then we all meet and talk about it. But
right,
almost sleep apnea, it's not like that. You go to different doctors and they only know, like, you're the nail and they're a hammer, and they're only going to offer you what they know. If you go to a sleep dentist, you're only going to get an appliance. If you go to a pulmonologist or a family doctor, you're only going to get a CPAP machine. If you go to an ENT, you're probably going to get some bad palate or uvula surgery or something you shouldn't be getting, because I went to the number 1 or 2, hands down. No one will argue. Baylor back in 1999 was the number 1 or 2 program in the United States of America, hands down. VA, Bentov, Children's, Methodist, St. Luke's, you know, facilities that we got to train at. And my training sucked in sleep. You know, it was terrible. And that's why I did the fellowship, because I knew that I was deficient. I knew it. And I knew when I worked at the VA and these vets would come in who can't use CPAP, and I couldn't help them. And I felt terrible that we were offering them just one operation. It was UPPP. And if that didn't work, well, we had UPPP. You didn't like it, it didn't work. Oh, you know, that's it. So that's the problem with sleep. And what I've been blessed with is that I have all this experience, and I have all of y'all guys to help, and y'all teach me day after day, patient by patient, you know.
Give everybody your website and your phone number.
Yeah, my website is sugarlandent.com, and our phone number is 281-556-1102.
James will be back again with us next month. James, thank you so much. Great show. Have a happy holiday. We'll see you next month.
Thank you. Merry Christmas. Thank you all.
Yeah, same to you. That's Dr. James Ludwig. That's it for us today. We'll be back again with you next week with more Ask the Experts.
Thanks for tuning in today to the Ask the Expert show on W4CY Radio and Talk4 TV. Tune in next week and every week to hear more from our experts on personal injury, insurance, air condition repairs, estate planning, Medicare, and many other topics in the areas of legal, health, financial, and home improvement. See you next week.